Good afternoon, everyone. This is Meldita and I'm back. This is general circulation versus coronary circulation in English. Dirty blood from the head, from the arms, and from the other parts of the thoracic region will get into the superior vena cava. That's its SVC. And the dirty blood is collected by the capillaries of the venous system to the venules, to the vein, to the SVC. Dirty blood coming from the lower parts of the body will be collected by the capillaries of the venous system to the venules, to the vein, to the inferior vena cava, going to the right atrium. So from the higher parts, SVC, superior vena cava, inferior vena cava, delivers the dirty blood to the right atrium. This dirty blood passes the tricuspid valve, which has 3 leaflets. And this tricuspid valve is supported by the chordae tendineae and the capillary and the papillary muscles to control the opening and the closure of this valve. Dirty blood passes from the right atrium to the tricuspid valve and down to the right ventricle. The right ventricle will deliver this blood to the lungs, but before that, the pulmonic valve has to open. The pulmonic valve has 3 cusps, and as it opens, the dirty blood from the right ventricle will travel from the right ventricle, passing the pulmonic valve, passing the pulmonary artery down to the lungs, left and right. The color of the blood on the right side of the heart is dark red because it has lots of carbon dioxide. So the carbon dioxide will be dropped off in the lungs, and the blood will pick up the oxygen, so it turns red. So the left side of the heart is color bright red because it has lots of oxygen. Okay, so this clean blood from the left lung and the right lung will be collected by the pulmonary veins, and they deliver this blood to the left atrium, which are 4 openings in here. The clean blood passes the mitral valve, which has 2 leaflets, and again supported by the chordae tendineae and the papillary muscles to control the closure and opening of this valve. The clean blood passes the left atrium to the mitral valve down to the left ventricle, and from the left ventricle, the blood will be pumped by the left ventricle, which is the main pump of the body, to the aorta. But before that, the aortic valve has to open before that blood will be ejected by the left ventricle to the aorta during systole. Okay, so during systole, the aortic valve opens, the left ventricle contracts, the aortic valve opens, the blood is ejected. That supply is called your stroke volume, and it goes up to the ascending aorta. So the clean blood will go to these arteries that leads to the brain, but there are also arteries, subclavian arteries, and another one that branches from the brachiocephalic artery to supply the upper extremities, the arms, left and right, and also some regions of the thoracic area. So as this clean blood traverses the aorta at the level of the thoracic down to the abdominal aorta, this aorta is connected to other arteries that become arterioles and capillaries of the arterial side to support all the organs of the body with clean blood. That means it has lots of oxygen and the nutrients. When blood is used up, the blood will be collected by the capillaries of the venous system to the venules, to the vein, and back again to the inferior vena cava, and the higher part back to the SVC or superior vena cava, and join again to the right atrium, and the cycle begins again. But this kind of circulation is during systole, when all of the other organs of the body benefit from the blood ejected by the left ventricle. In the case of the coronary circulation is different. So this is during systole. During diastole, this is when your coronary muscles or your heart muscles benefit from the blood supply brought by your coronary arteries. The right coronary artery is coming from the right coronary cusp, and the left coronary artery is coming from the left coronary cusp. There is a cusp there which has no use, it has no opening, and this is where the blood passes going to the right coronary artery to its branches to support the right ventricle and to the back. The left coronary artery actually becomes left main, that divides into left anterior descending, that supports the anterior part of the heart muscle, and the circ, which supports the lateral side of the left ventricle, lateral part of the left ventricle, and down at the back. So that is the anterior view of the heart. Not only that, these coronaries also support the conductive tissue, the SA node and the AV node in the Purkinje system. They also support the conductive tissue besides those muscles or those contractile muscles of the heart. At the back of the heart, we see that the right coronary artery make a wraparound and also connect to the posterior descending artery. And that's why they call it the right dominant circulation. Or it could be the circ that will connect to the PDA and it becomes the left dominant circulation. Or it could be the circ has a PDA and the RCA has a PDA and you say co-dominant circulation. So when blood is used up, the veins from the anterior heart will be collected by the great veins. At the back will be the middle cardiac vein and some veins. And this dirty blood will be going to the bigger vein, to the coronary sinus. So the coronary sinus is an opening also in the right atrium, and the cycle begins again. So, as we said, systolic circulation is when the left ventricle contracts and opens the aortic valve to deliver clean blood to all parts of the body, except during diastole, the aortic valve closes and delivers the blood to the heart muscle and to the conductive system. So the left ventricle, I will isolate this, is here. It has thicker muscles, that's why it's called the pump of the body, the main pump of the body. It has a septal wall, anterior wall, lateral wall, and inferior wall. So this is the left ventricle walls, anterior wall. We got the septal wall, lateral wall, and we have also the inferior wall. And that is diaphragmatic, sometimes it's called the floor of the left ventricle and a little bit at the back. So it's like compared to a shoe with a heel, and that looks like that. Okay? So that is the, I title it general circulation. Actually, we have the right ventricle that provides the pulmonary circulation, and we have the left ventricle that provides the systemic circulation, but I just term it general circulation. And then that happens during systole, but this coronary circulation happens during diastole, and that's about it. I hope it will enlighten you a little bit. And if you think my presentation is okay, you're welcome to press like and subscribe. Again, thank you. This is Mel. Thank you.